The term patient panel often used to describe a group of patients that you see as a nurse practitioner regularly. In other words, the patients on your panel think that you are their go-to provider. Building a patient panel is crucial to increase your productivity, which often used to evaluate the performance for nurse practitioner. Building a solid patient panel also helps nurse practitioners to increase their work efficiency, because if you already know the patient well, you can go into the problem that they have right away rather than get to know them and obtain a thorough past medical history like you would do for new patients. If you work in a group setting, you might have your own patient panel, or you may share a patient panel with your colleague. In many cases, patients can voice their preference of which provider they want to see. So if you have a larger patient panel, that usually means that a lot of patients like to see you. And from employer's perspective, that means that you are very productive, meaning that bringing a lot of reimbursement to the business. In some practice, nurse practitioners can get extra bonus based on the productivity. So building a patient panel can directly affect your income. If you own your clinical practice, having a solid patient panel is even more important so you can sustain your business and thrive. So in this episode, I'm going to talk about 5 tips to build a solid patient panel as a nurse practitioner. Let's dive in. Aloha, I'm Miki Miura, a family nurse practitioner in Hawaii. I've been a nurse practitioner for 10 years, and I absolutely love being a nurse practitioner and the lifestyle that Korea has given me. My passion is mentoring nurse practitioner students and new grad nurse practitioners to build amazing careers so that they can have the freedom of choice on what they want to do and how they want to live. All right, let's get into it. So in this episode, I'm gonna talk about 5 tips to build a solid patient panel. First tip is to take your time to introduce yourself. When you go in, you want to shake your hand, you want to explain who you are and what you do. If they're not familiar with nurse practitioner profession, you want to take time to explain how nurse practitioners are trained and what we can do as a nurse practitioner. This way, they will remember you and likely to request to see you again when they come back to the office, rather than they go home and not sure who they saw. This seems like a very easy step, but a lot of times people may skip this process because they're so busy. But building a patient panel takes time, and this is a crucial step to build a trust relationship with the patient. Second point is to spend time to get to know the patient. On top of listening to their concerns and questions, I also ask them what they do for a living, what they like to do during their free time, how many children they have, who they live with, where they like to go on vacation, and so on. You definitely have to make sure that patients are comfortable talking about their private life, but many patients gladly to be asked about them and talk about themselves. And by getting to know them, we can build a solid personal relationship with the patient. And also we can send a message to the patient that we would like to understand them. This oftentimes increases patient satisfaction and trust to the healthcare professional, and they likely to come back to see you again for the next visit. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner, and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews well, so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Third tip is to schedule a follow-up appointment at the end of the visit. Instead of saying, okay, come back whenever you have concerns, it's very important to tell them that, okay, let's come back in 1 year for a checkup, or maybe in more sooner, come back in 3 months. I want to check on certain things to make sure that things are getting better. And not only to give them a recommendation when to follow up, I would help them to schedule the next appointment. So either you can task your staff to schedule, or you can schedule the appointment yourself, depend on your clinical setting. The reason for this is because patients are all busy, and sometimes they forget to take care of themselves. And the routine healthcare checkup is so important. And even if you tell the patient, okay, come back when it gets worse, but patient may get busy and forgot to come back, or they don't prioritize their health. But if you tell them, okay, come back in 3 months and then we'll discuss about this again. And oftentimes when I talk to the patient, hey, so how are things with that problem? And patient may say, actually, it's getting worse. So I told them to come back sooner, but because they had such a busy life, they may not come back unless I tell them, okay, let's recheck in 3 months and rediscuss this. So scheduling follow-up appointment at the end of the visit is very important for both patients and for us. Fourth point is to remind for routine checkup. Like I said, everybody has very busy schedules, and patient may not prioritize their health unless they're reminded or unless they have an actual health problem. But as a nurse practitioner, we want to focus on preventive measures and early detection of disease and conditions. I mainly provide women's health care, and I remind patients to come back for annual woman exam a month before it's due. I work for 2 clinical sites, and for one site, staff actually send a reminder for me. For the other clinical site, I send a reminder on my own. Either way, sending a reminder will help to increase the productivity. Also, patient really appreciate, thank you for reminding me that I totally forgot that I'm due for pap smear. I know that it takes extra time to send a reminder, but this will be helpful for both patient and for us. And fifth tip is focus on providing the best care you can provide. I know it sounds kind of silly because this is a common sense, but if you provide the best care and your patients satisfied with the care that they receive, then they may talk to their friends and family to go see you because you are such a good provider. Word of mouth is one of the best ways to attract new patients. In fact, I have a lot of patients who were recommended to see me by their sisters, by their mothers, by their daughters, by their coworkers, and by their friends. So it's very important to try your best to provide the best care you can provide, and I do so every single day. I hope this episode was helpful for you. If you like this episode, please make sure to give me a thumbs up and subscribe to my channel. I upload a new episode every week. Also, write down in the comment section what kind of tip you have to build a patient panel. What kind of success story that you had. I would like to hear that. All right, I'll see you in the next episode. Aloha.